Welcome back, everyone. So in the last video, we spoke about colon cancer screening. Today, as I had informed you, we are going to talk about breast cancer screening. So again, screening is done for anyone who doesn't have symptoms. We do it so that we check if you have early cancer. So who gets breast cancer screening? Breast cancer screening is done for patients who are from the age of around 35 to 40 up to the age of around 70 to 75. Okay? Now, the way it's done, it's different in different age groups. First of all, for anyone from the age of 25, they could get breast examination. But for once they reach the age of 35, what we do is we do clinical breast examination and mammographies. So from the age of 35, we start doing clinical breast examination. That means I would examine both breasts to see if there's any abnormality. And we do imaging. Imaging meaning it's either a mammography or an ultrasound, or the two of them together. Now, mammography is like an X-ray. It's the basic thing in any breast cancer screening program. So a clinical examination, meaning me examining the breasts, checking your breasts, it's not enough. What needs to be done is that examination together with the mammography. Now, from the age of 35 to 40, we can do this either every 2 to 3 years or every year, depending on the risk. However, from the age of 40, it has to be annual. That is, every single year. You do both clinical examination and the mammogram. Now, these are the guidelines here in Kenya. If you go to a physician in other countries, they have different guidelines for different age groups. For instance, in Europe, they may start the screening at the age of 45 instead of 40. Or for some of them, it may even start at the age of 50. That usually depends on how the cancer is in that country, the cancer incidence and prevalence. In our country, we notice many people around the age of 40 getting breast cancer, unfortunately. So that's why our guidelines say we start our screening from the age of 40, and we can even take it back to the age of 35, but from the age of 35 to 40, we don't do it every year. We can do it maybe every 2 to 3 years. So if you're a woman who is above the age of 35, or you have relatives around that age group, encourage them to go for their breast cancer screening. It reduces the chances of mortality, and the early detection of breast cancer has really made an impact on reducing the number of cases that die from breast cancer, because it is curable in the early stages. So the earlier we detect it, the better for you, the better for everyone. Thank you for watching. On the next video, we are going to talk about the symptoms of breast cancer. It will be the Breast Cancer Awareness Month, that is October. So all my videos in October shall be around breast cancer. Stay safe and stay healthy.